I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery, and welcome to this video edition on your vision in thyroid eye disease. So, people often complain of visual problems: irritation, blurring, watering, glare and dryness. They're the main things that patients with thyroid disease complain of. So why do you get it? Well, thyroid disease is an immune condition. It's inflammatory, and that inflammatory extends to tissues around the eye and around the front part of the eye. Inflammation there, and you will complain of irritation. You'll also complain of dryness because inflammation presents as a dryness. So patients will often say, "Oh, but treat as a dry eye." It can be a bit tricky because often these patients will also be treated as allergic eye disease, a bit swollen, a bit irritated. So they'll be diagnosed with allergic eye disease when in fact they've got thyroid disease. The blurring is all sorts of things. Firstly, the eyelid is pulled up, the eyeball can be pushed forward, the tear film is altered, and all of that will give you blurring. So it's multifactorial. Patients will go to their optometrist, change their glasses, not work, complain, go, "Oh, these glasses are wrong," but the whole environment is changing, their eye is changing. As the eye comes forward and it gets squashed, the shape changes, your prescription will change. The big one is glare, of course, because inflammation will give you glare, but also the eyelids go up, particularly in the outer part, and that's called lid retraction. So these patients complain of glare, and what they say is they can't stand different lighting conditions. Sunlight's terrible, fluorescent lights are terrible, and we call that photophobia. And they'll come in with a whole mix of complaints of all these symptoms, and they're not sure what the hell's going on, and they'll all be told they have dry eye or allergic eye disease, but it's thyroid disease. Finally, they also have watering. Why do they get watery eye? Well, inflammation. If you imagine if you have something irritating your eye, causing inflammation, you will lacrimate, you'll water. So watering can be secondary, but also the inflammation extends to your tear drainage system and reduces tear drainage, so you get a watery eye. Often that resolves with treatment like radiotherapy or once you settle the thyroid disease down. So they're the major complaints that people come to me with and try to explain to me, although they have trouble using the words. They pick all the wrong words. But there's two other issues with vision that you must be aware of. You can actually lose vision. And you can lose vision because in thyroid disease, if it's advanced and you may not have any other symptoms, it just might be that your vision's getting worse. The nerve that runs back behind the eye into the eye socket is literally squashed. And that's urgent. We call that compressive optic neuropathy, but basically what it means is your nerve of sight is being squashed. It's being squashed by all the tissues in the eye socket behind the eye, and that's an emergency. I had a young lady walk in on a Tuesday, and it was literally about 2 in the afternoon with reduced vision in one eye, and she had had permanent vision loss from thyroid disease, urgent scans, and I said to her, "You are having a decompression tomorrow." And we urgently decompressed her the next day, and the vision came back up. So that's a very, very special type of vision loss. And there's something else that can happen that's subtle and insidious. Because the eyeball's being squashed, the eyeball's coming forward, the tissue, the muscles, all putting pressure on the eyeball, the pressure goes up and it's squeezing the eyeball. And pressure going up is called glaucoma, and glaucoma is a thief of sight, and you will permanently lose vision from glaucoma. So I will decompress people if they've got uncontrolled pressures, and they sit there and they'll put drops in and they'll make it all worse, and it doesn't bring it under control, and basically the eye socket's saying, "We're under too much pressure, decompress me." You decompress it, pressure goes down, and their glaucoma disappears. So that's it. It's a complicated scenario. There's a lot going on, but I hope that all makes sense. As always, if you've got any queries or concerns, you can contact the practice. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney.